In this section, I will discuss how caste-based discrimination affects access to nutritious food and healthcare for marginalized groups in India. Caste is a social system that divides people into hierarchical groups based on their birth, occupation, and purity. The lowest caste groups, known as Dalits or untouchables, face oppression and exclusion from the upper castes, who dominate the economic, political, and cultural spheres of society. One of the ways that caste-based discrimination manifests itself is through food practices. Food is not only a source of nourishment, but also a marker of identity, status, and morality. Upper caste groups impose dietary restrictions and taboos on lower caste groups, based on the notion of purity and pollution. For example, Dalits are often forbidden from eating beef, pork, or other animal products that are considered impure or dirty by the upper castes. They are also denied access to clean water sources, cooking utensils, and public eating places that are reserved for the upper castes. These practices deprive Dalits of essential nutrients and expose them to health risks such as infections, diseases, and malnutrition. Another way that caste-based discrimination affects the health of marginalized groups is through the denial of healthcare services. Dalits face discrimination and violence when they seek medical attention from upper caste doctors, nurses, or pharmacists. They are often refused treatment, given inferior quality medicines, or charged higher fees than other patients. They also face harassment and humiliation from upper caste staff and patients who question their right to occupy hospital beds or use medical facilities. These barriers prevent Dalits from accessing timely and adequate health care, leading to higher mortality and morbidity rates among them. Caste-based discrimination is a major obstacle to achieving food security and health equity for marginalized groups in India. It violates their human rights and dignity, and perpetuates their poverty and vulnerability. To address this issue, there is a need for legal reforms, social awareness, and political mobilization that challenge the caste system and its oppressive practices. There is also a need for inclusive and participatory food security programs that ensure the availability, accessibility, and affordability of nutritious food and health care for all people, regardless of their caste identity. How caste influences food preferences and dietary habits, and how genetic differences in taste receptors may affect health outcomes. Food is not just a source of nourishment. It is also a marker of identity, culture, and social status. In India, food preferences and dietary habits are deeply influenced by the caste system, which divides people into hierarchical groups based on their birth and occupation. The caste system also imposes strict rules and taboos on what people can eat and who they can eat with. These rules are based on the notions of purity and pollution, which are central to the Brahminical ideology that dominates Hindu society. According to this ideology, Brahmins, the highest caste group, are the most pure and must avoid eating meat, especially beef, which is considered the most impure and inedible food. Meat eating is associated with lower castes, especially Dalits, who are the most oppressed and marginalized group in the caste hierarchy. Dalits are often forced to eat the leftovers of animals that are discarded by the upper castes, such as cow carcasses, pigs, rats, and dogs. These foods are labeled as dirty and filthy by the upper castes, who regard Dalits as untouchable and polluting. However, food preferences and dietary habits are not only determined by caste norms and social pressures. They are also influenced by genetic factors that affect how we perceive and enjoy different tastes. Scientists have discovered that there are variations in the genes that code for taste receptors, which are proteins on the tongue that detect different flavors. These variations can make some people more sensitive or less sensitive to certain tastes, such as sweet, bitter, sour, salty, and umami. For example, some people have a genetic variant that makes them more sensitive to bitter tastes, such as those found in vegetables like broccoli and cabbage. This variant is more common among people of African and Asian descent than among people of European descent. This could explain why some people find these vegetables more palatable than others. Another example is a genetic variant that affects how we perceive cilantro, a herb that is widely used in Indian cuisine. Some people love cilantro and find it refreshing and aromatic, while others hate it and find it soapy and metallic. This variant is more common among people of European descent than among people of Asian descent. This could explain why cilantro is more popular in some regions than others. These genetic differences in taste perception could have implications for health outcomes. For instance, some studies have suggested that people who are more sensitive to bitter tastes may be less likely to consume vegetables and fruits that are rich in antioxidants and vitamins. This could increase their risk of chronic diseases such as cancer and diabetes. On the other hand, some studies have suggested that people who are less sensitive to bitter tastes may be more likely to consume alcohol and tobacco, which are known to cause harm to health. Therefore, food preferences and dietary habits are complex phenomena that are shaped by multiple factors, including caste, culture, environment, and genetics. Understanding these factors can help us appreciate the diversity of food cultures in India and the world, as well as the challenges and opportunities for improving nutrition and health for all.